Sexual and reproductive health activists in Nakuru County today appealed to the national and county governments to provide comprehensive sexual and reproductive health education and enhanced access to contraceptives. The activists said that many women and girls resort to unsafe abortions due to stigma and misinformation, with impoverished women bearing the brunt. The Center for Reproductive Rights reports that 7 women in Kenya lose their lives to unsafe abortions every day.
Wale ambao wanahakikisha kwamba sheria zinabuniwa katika taifa letu la Kenya, ya kwamba waweke maisha ya mwanamke katika taifa letu la Kenya isiwe maisha ya kubahatisha. Maisha ya mwanamke iwe katika hali ya kuheshimika kisheria kikatiba.
According to the Kenya Legal Ethical Issues Network, survivors of sexual violence incur high costs for post-abortion care, putting a strain on the country's healthcare resources.
At the end of the day, since we champion for right to health, is to ensure that the number of deaths arising out of unsafe abortion are ultimately reduced.
The Constitution is recognizing every person and without discriminating even the age. So when a young person works in a health facility in this country, it's very vital that that young person receive the services that they require to have based on the article that has put in that Constitution.
Speaking at an event to mark International Safe Abortion Day, the activists attributed the prevalence of unsafe abortions to Kenya's restrictive constitution, which limits abortion to emergencies and cases where the mother's life or health is in danger. The Ministry of Health suspended the guidelines for reducing mortality from unsafe abortion in 2013, and despite a High Court judgment ordering their reinstatement, they remain suspended.
Some of these pregnancies arise out of rape, defilement, yet the law clearly protects these victims of sexual violence to actually access safe abortion and safe termination methods.
This comes as the country grapples with a teenage pregnancy crisis, with a 2021 report by the ODPP showing that defilement accounted for 3 out of 5 sexual offences cases filed in court.
We've been experiencing a dropout from school from these teenagers. And we've also had severe cases of sex for sanitary towers. As the county government and as the Department of Gender, we are coming up with a program for the sanitary pad distribution so that our girls don't suffer.
Elsewhere in Kakamega, health stakeholders called upon the county government to avail sign language interpreters in hospitals and public offices to ensure persons with disabilities have access to comprehensive sexual and reproductive health services.
When it comes to HIV and AIDS, when the deaf person comes for testing, and the person who is testing is a hearing person, how will the deaf attest that information?
Muriel Adhiambo, K24 TV.